So, good evening, ladies and gentlemen. This is Dr. Sudarshan, bringing to you the latest in the series of psycho awareness videos. If you like, do subscribe to my YouTube channel and do share. So, first of all, greetings on World Schizophrenia Day 2023. Now, what is schizophrenia? Schizophrenia is a complex mental health disorder. Okay. Now, schizophrenia, unlike the popular perception, is very much a treatable disorder. It is very much a treatable disorder, and it has been seen that patients who have undergone the treatment for schizophrenia, the success rate is almost close to 75%. Now, schizophrenia is actually a disorder of the mind, a complicated disorder of the mind, which manifests itself as altered behavior. Now, this altered behavior can be broadly categorized. May have altered sense of thinking, or the patient may be unduly aggressive or may be withdrawn. Also be unusually fearful and non-interactive with other members of the society. This is how schizophrenia actually manifests itself as altered behavior. Symptoms of schizophrenia are broadly classified into two main categories: the positive symptoms and the negative symptoms. Now, most of the patients who come to the OPD, psychiatric OPD, they present with positive symptoms. Positive symptoms are like hallucinations, auditory mainly, or visual. In auditory hallucination, the person hears voices of persons coming from persons who are not present. In visual hallucination, the person sees others, so talking about him or otherwise, but they are actually not present. Then there are delusions. The person may think that others are plotting against him and he is being persecuted. Or the person may think that he's a very, very powerful person or she's a very powerful person having immense powers. So these are the positive and the negative symptoms of schizophrenia. As the negative symptoms of schizophrenia are concerned, these negative symptoms are actually more difficult, to find out. The person usually comes, as I said, because of the positive symptoms like hallucinations and delusions to the psychiatric OPD. In negative symptoms, the person actually withdraws himself or herself inter- in interaction with the society. The person stops performing activities which he or she used to find pleasure in, like playing cricket. Nowadays, does not find interest in playing cricket. And of course, the person withdraws himself into a shell sort of interaction. In other symptom clusters of schizophrenia, the person may neglect this personal hygiene, his dressing. The person may be improperly dressed or shabbily dressed with dirty clothes, not taking baths for days, etc. Or person may exhibit bizarre behavior. This is because of his thinking, his perception, which have been altered. His attention, his memory, his decision taking powers, his cognitive, you know, facets of his personality, these are also altered. And this is where we, as members of the society, actually fail from performing our duties. We actually misunderstand a person with schizophrenia because of his bizarre behaviors, because he's not able to remember everything. He's not able to decide. Perhaps he's not grooming himself properly, unshaven for days, or wearing tattered clothes, not taking baths for days, smelling. So we should not misunderstand. Rather, we should empathize with the patient. We should recognize and always feel that this person is suffering from a serious mental health disorder. So he is not expected to behave the way which we do. In positive symptoms, as I said, the person exhibits certain things, symptoms like hallucination, delusions, which are not normally found in a person. And in negative, he or she exhibits things which are usually found in a person but not being able to expressed properly by the patient. He or she is not able to express properly certain things which a normal person is expected to do or perform on a daily basis. As I said, not taking baths regularly, wearing tattered clothes, and not able to take decisions, not able to remember properly also. So, performing certain actions, meaning muttering to himself or herself, and that may seem unnatural to us. Yes, it may seem unnatural to us, but then we should understand that he or she is a patient. So we have to empathize. And I can tell you that worldwide, 1 in 100 persons suffer from schizophrenia. In India, that roughly translates to 1 crore of the population. So I think that's a significant portion. And the way the society deals with the patients largely determine the outcome, the maintenance, and the relapse of a person who is suffering from schizophrenia. Okay. What are the causative factors of schizophrenia? There are multiple causes actually, and the causes are almost always not very easy to to nail. But genetic factors do predispose. If many members of the family suffer from similar disease, then the son or the daughter has more chances of suffering from schizophrenia. Does not mean that they will suffer. I mean, for example, if your father or mother has been suffering from diabetes mellitus or hypertension, high blood pressure, then you have more chances. But it's not absolute that you will get hypertension or you will suffer from blood sugar. You may suffer from neither also or both. So, in the case of schizophrenia, also how the mother is treated when the baby is in the womb, that's neonatology, that does influence. The mesolimbic system, which gives rise to the brain, that its development is influenced by how the mother is treated when the fetus is still, the child is still in the womb. What the mother eats also, the perfume she wears, all this influence, the habits of the child, either to unborn child. Then, of course, the care of the mother after the child is born, the care of the child after he or she is born, and then later on in life, how the society actually the interaction the child or the mother faces in the society, that influences to a large extent that whether schizophrenia will manifest itself in later lives or not, and the severity. And after a person is affected by schizophrenia, the way the society interacts with the patient, as I said, influences to a large extent. So apart from antipsychotic medications, which we usually prescribe for patients with schizophrenia, we also have to educate the caregivers. Caregivers means we members of the family, we members of the society, we members of the workplace, we members of the school, we members of the college, we members of the social club, anywhere, profession. We should empathize with the patient, and believe me, the patient will lead a normal or near normal life and will not suffer from any relapse also. So this is the message I wish to give to you on World Schizophrenia Day. And please be my ambassador and percolate these thoughts to other members of the society when you're chatting with them. And that will help us destigmatize any sort of mental illness. Remember, mental illness is just like any other physical illness. It's just like any other physical illness. So, and in case of mental illness, mostly, apart from addiction, and in this case, I might add that abuse of substances like cannabis and methamphetamine, they do lead to the precipitation of schizophrenia. Okay, so if you are abusing substances, so we are responsible for it. But in case of schizophrenia, mostly they are factors which are outside our control. The society, our pre-birth history, etc., they influence. So obviously, a person of schizophrenia, suffering from schizophrenia, deserves more empathy than perhaps a person who is suffering from alcoholism, cigarette smoking, drug intake, etc. Even they deserve sympathy, but or empathy. But the schizophrenia patients, basically they need more understanding from mine. So till the next video comes in, uh, please percolate all my messages to other members of the society. But that will these videos are aimed at raising the awareness amongst the non-medical persons of our society. It's not meant for psychiatrists. For psychiatrists, you should consult a mental health professional. There are no conflicts of interest, and this is only for raising the awareness amongst the common masses or mental health disorders. So, till the next video comes in, goodbye from my end.